Okay, doctor. So welcome. Dr. Bruni here, coming your way. And so today's class is approach to abnormal weight. You may ask, why are we doing approach to abnormal weight? So you just go to Medical Council of Canada objectives. You click that, and then, as usual, I said you'll see this interface. Go down, and you're being examined here on the medical expert part. So click on that, and then when you go there, something interesting is going to come up. You're going to see all the objectives listed from A to Z. Currently, we've reviewed a lot of the topics here, almost all of them, even in the live Facebook app. But then, why are we doing abnormal weight? Because if you remember, the last time we did abnormal white cell count, where we dealt with HIV, okay? And so now, with these live webinars, what I'm doing is I'm teaching from below, right? And then the other ones I do on Sundays, I'm teaching the topics from above. And then you realize that abnormal weights, you need to cover obesity, weight loss, eating disorders, anorexia nervosa, intrauterine growth restriction. So what I'm doing today is, but I'm going to touch on some key things which are also necessary for you to remember so far as this objective is concerned. And why are we dealing with this? The rationale for it is that weight loss may be a symptom of serious underlying condition. All right, doctors? So the causal conditions can be psychiatric disease, anorexia nervosa, bulimia, chronic illness, esophageal cancer, alcohol, opiates, cocaine, amphetamines, anti-cancer medications, right? So if you are learning this particular objective, all you need to do is to look at the topics which are being listed by the Medical Council and just start writing them down. And make sure that you've covered each of them one by one. Okay? So, for example, you cannot tell me that you finished this particular objective without completing anorexia nervosa. You can't say you've completed this objective without covering bulimia nervosa, without covering esophageal cancer, right? So the topics are there for you. You can't say you finished this if you are not covering hyperthyroidism, COPD, heart failure. Of course, COPD and heart failure, you will meet them in other objectives as well, okay? And excessive physical exercise. So, and then malabsorption, diabetes. So even with this alone, you'd have covered more than 15 topics. So if somebody is asking you, what are high yield topics I need? Just tell them, go to the objectives and figure it out. Or to make it simpler, just come to MedCognito. We've already done that work for you. Okay, so what are some of the key things we are going to cover today? We have to pick some of these conditions, and then given a patient with weight loss, the candidate will diagnose the cause, the severity and complications, and will initiate an appropriate management plan. Okay? In particular, the candidate will investigate for underlying medical conditions where appropriate. Good. Now, enabling objectives. Given a patient with weight loss, the candidate will list and interpret critical findings, including identify the primary mechanism of weight loss, that is decreased nutritional intake and increased expenditure. So there are two ways we lose weight: by decreasing caloric intake or by increasing expenditure. And how do we increase expenditure? By exercising. How do we increase expenditure? By having conditions which increase our metabolism, like hyperthyroidism, like if a patient has cancer, like if a patient has, any chronic medical illness, okay? And then recognize the features of anorexia nervosa where present. Identify medical consequences of weight loss. So doctors, when you are learning whichever book you're going to use, these are the things you should be picking up, right? And then you move on, list and interpret critical investigations, including the assessment of the nutritional status of the patient, including appropriate laboratory investigations, right? So don't talk about anorexia nervosa without dealing with labs. Don't talk about bulimia without dealing with labs. Don't talk about hyperthyroidism without dealing with how you're going to interpret those things. Prepare for the QE1 is simple. Now, investigation of potential underlying medical conditions like blood glucose, thyroid-stimulating hormone, and investigation of social and family history. Those are the psychological stresses. All right. And then construct an effective initial management plan, including initiate nutritional support or counseling. So, what is going to happen if you initiate nutritional support in a patient with anorexia nervosa? What is going to happen? Like, what are the complications of starting treatment in a patient with anorexia nervosa? And initiate treatment of underlying medical condition, if appropriate, and referring the patient to specialized care when necessary. All right. So these are the things you need to start paying attention to. So let's start with the first question. So what we do is that we will do a question based on these objectives, and based on the question, we will give a teaching point. Let's go. Who is going to read for us, please?
Am I going?
I'm going to read. Okay.
Let's go.
Oh.
Let's go.
A 17-year-old girl presents with significant weight loss over the past 6 months. She expresses intense fear of gaining weight despite being underweight and engages in excessive exercise. Which of the following is not a core feature of anorexia nervosa?
Beautiful.
A, persistent restriction of energy intake. B, intense fear of gaining weight. C, binge eating followed by purging. D, distorted perception of body weight and shape.
Beautiful. Please, doctors, send me your answer. What is it? Is it A? Is it B? Is it C? Or is it D? So, what is the answer? I've gotten about 8 answers so far. Dr. Kenza is also saying, so it looks like everybody's going for C. Dr. Tin, why did you go for D? The correct answer, everyone is going for C, C, C. And the correct answer is C. He said, which of the following is not a core feature of anorexia nervosa? So, that means that when you are studying, you have to know the core features of anorexia nervosa. And the core features are 3 things. 3 things. Number 1, you have a patient who has persistent restriction of energy intake, like persistent restriction of food. That is a core feature of anorexia nervosa. Number 2, a patient who has intense fear of gaining weight. That is another core feature of anorexia nervosa. And then a patient who has a distorted perception of body weight and shape. That is also another feature of anorexia nervosa. Which of these is not a core feature of anorexia nervosa? It is a patient who is binge eating followed by purging. Now, there's a type of anorexia nervosa which comes with that, but that is not the main feature. So we have one type of anorexia nervosa, which is binge eating with purging subtype, right? But while binge eating and purging can be present in an anorexia nervosa, it is more characteristic of bulimia nervosa. So even though you can have a subtype of anorexia nervosa, so this one is not saying which of these is not a feature of anorexia nervosa. It says which of these is not a core feature. That is where the answer is coming from. That is where the issue is coming from. A core feature. All right. So doctors, are we all on the same page? Are we all on the same page? Are we all on the same page? Because I want to move on. Okay, good. Okay, let's go on to the next question. So today is going to be question and answer to get the concept. So we have to know the core features of anorexia nervosa: fearing to eat, fearing to gain weight, and then a distorted body image. Now, I need somebody to take this question for us as well.
Can I read?
Yes, please read. Yeah.
20-year-old male with a BMI of 16 presents with a history of obsessive thoughts about food and body image along with compulsive exercise. What is the most appropriate initial treatment focus for this patient?
Beautiful.
Option A, treating comorbid depression. B, initiating weight restoration. C, addressing body dysmorphic disorder. D, it's treating substance use disorder.
Good. What is your answer? Is it going to be A, treating comorbid depression, B, initiating weight restoration, C, addressing body dysmorphic disorder, or D, treating substance use disorder? Which of them? Which is the most appropriate initial treatment to focus on? Are you going to just treat a comorbid depression, initiate weight restoration? The BMI is 16, with a history of obsessive thoughts about food. And the correct answer is B, B, B. Dr. Jackie Lowe, you went for C. Dr. Akano, you got that right. You went for B. So this patient, look, the BMI is 16. weight restoration is the primary treatment focus for patients with anorexia nervosa to address the immediate health risks. Yes, the patient may have depression. Yes, the patient may have body dysmorphic disorder. Yes, the patient may have substance use disorder. However, the first thing you want to focus on is to make sure that this patient's weight, is being restored. That's the first thing you want to deal with, because if you start dealing with that, then you know that you are getting the patient, in the right space. Okay. Now, I have another question for you. I will need somebody else to read it for us, please. Please, who volunteered to read?
A 22-year-old female with anorexia nervosa is being assessed for cognitive function. Which cognitive domain is least likely to be impaired in anorexia nervosa? A, verbal learning and memory. B, visual learning and memory. C, visuospatial ability. D, numerical calculation.
Okay, good. Please type in your answers. Those on Facebook, please type in your answers. So you think you know anorexia nervosa? Let's do the test and see, right? Which cognitive domain is least? The question is least likely to be impaired. So yes, so it looks like patients with anorexia nervosa may have some cognitive impairments. They may. But then which of these is least likely to be impaired? Is it A, their verbal learning and memory? B, their visual learning and memory? C, their visuospatial ability? Or D, their numerical calculation? Let me see the answers people are. Oh, good. Dr. Freddy, please check your answer. Dr. Neka, that looks great. Dr. Kinza, please check your answer. Dr. Amna on Facebook, that's awesome. And what is the answer? Drum roll. D. Please make a note in your chat. As we are going through, be making notes. Doctors on Facebook, please be making notes. Which of these is least likely to be impaired in anorexia nervosa? It is numerical calculation. Anorexia nervosa commonly affects verbal, visual learning, memory, visuospatial ability. Okay? It affects all these. The one which is likely to be least affected is numerical calculation. It is typically not highlighted as an impaired domain. So please, when you are learning anorexia nervosa, ask yourself, what are the domains that can be affected in the patient's cognitive impairments?